Okay, we're live now.
All right. All right, we will call to order the regular meeting of the Seminole Gas Authority. Roll call, Jay.
Bill Wantland,
Here.
Stephanie Lambert, Tim Pop. Is Tim there?
Not seen.
He went to put his dog up.
Oh, okay. Trace Connor,
Here.
Who did you say?
John
Tim's-
Kramer. Tim is here. I got
Yeah,
you.
thank you.
Sir.
I was
Chris-
muted.
Here.
Larry Church,
Here.
Corey Crabtree,
Here.
Jeff Griffin.
Here.
We have a quorum.
Consideration and action of consent agenda.
Move its approval.
Second.
Roll call, please, Jay.
Bill Wantland,
Yes.
Tim Poplin,
Yes, sir.
Trace Connor,
Yes.
Chris Anson,
Yes.
Larry Church,
Yes.
Corey Crabtree,
Yes.
Jeff Griffin.
Yes.
Motion passes.
With no items removed from the consent agenda, do we have any appearances or petitions from the audience for the Seminole Gas Authority?
Mayor Griffin, this is the moderator. We have some people from the public in. Hang on a sec. Let me see if they can raise their hand.
So we would like to remind everyone joining us that if you do have a question or comment, there's a raise your hand button. Please click it at the appropriate time. We will have an open hearing in our regular session of the City Council, where if it's pertaining to the City Council at that time during our regular meeting, that would be the appropriate time to raise your hand for comments. If it's not pertaining to the Gas Authority or any of the authorities, please wait.
Okay, Mayor Griffin, I think we're okay on that. I don't see anybody raising their hand.
Thank you. With that, I would entertain a motion for adjournment.
So moved.
Second.
All in favor?
Aye.
Aye.
Those opposed, like sign. All right, with that, we will move on. Well, I kind of went out of order, didn't I? Well, we'll move on to the Seminole Airport Authority. Roll call, please, Jay.
Corey Crabtree,
Here.
Tim Poplin,
Here.
Trace Connor,
Here.
Bill Wantland,
Here.
Stephanie Lambert, John Kramer, Larry Church,
Here.
Chris Anson,
Here.
Jeff Griffin.
Here.
We have a quorum.
Consideration and action of consent agenda.
So
Move its
moved.
approval.
Second.
Roll call, please. Roll call, please, Jay.
Corey Crabtree,
Yes.
Tim Poplin,
Yes.
Trace Connor,
Yes.
Bill Wantland,
Yes.
Larry Church,
Yes.
Chris Anson,
Yes.
Jeff Griffin.
Yes.
Motion passes.
With no items removed from the consent agenda, do we have any appearances or petitions from the audience for the Airport Authority?
Mayor Griffin, as moderator, I don't have any hands up right now.
Thank you. With that, I would entertain a motion for adjournment.
So move.
Second.
All those in favor, say aye.
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 Those opposed? All right, with that, we will move on to the regular meeting of the Seminole Utilities Authority. Roll call, please, Jay.
Trace Connor,
Here.
John Kramer, Chris Anson,
Here.
Bill Watland,
Here.
Corey Crabtree,
Here.
Tim Poplin,
Here.
Stephanie Lambert, Larry Church,
Oh, I'm here.
Jeff Griffin.
Here,
We have a quorum.
consideration and action of consent agenda.
Motion
So
to
moved.
approve.
Second.
Roll call, please, Jay.
Trace Connor,
Yes.
Chris Anson,
Yes.
Bill Watland,
Yes.
Corey Crabtree,
Yes.
Tim Poplin,
Yes.
Stephanie Lambert,
Yes.
Larry Church,
Yes.
Jeff Griffin.
Yes.
Motion passes.
With no items removed from the consent agenda, do we have any appearances or petitions for the Seminole Utilities Authority?
Mayor Griffin, this is moderator.
Yes.
I'm not showing any hands up at this time.
All right, thank you. With that, I would entertain a motion for adjournment.
So move. Second.
All those in favor? Aye.
Aye.
Those opposed, like sign. All right, with that, we will move to the regular meeting of the Seminole City Council. Roll call, please, Jay.
Chris Anson,
Here.
Larry Church,
Here.
Stephanie Lambert,
Here.
Trace Connor,
Here.
Tim Poplin,
Here.
Bill Watland,
Here.
Corey Crabtree,
Here.
John Kramer,
Here.
Jeff Griffin.
Here,
We have a quorum.
thank you. Please rise for the Pledge of Allegiance. Salute the flag. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Bill, would you please lead our prayer?
Shabajazi, Mado, Moment Potalofa, Seminole, Moment Poestia Morgan. Zaka, Omis, Moment Poestia Morgan, Omada Chafikni. Lord, thank you for the city of Seminole and for all our people. Our prayer is that all our people remain well. Amen.
Amen. Thank you.
Bill.
All right, we'll move on with remarks and inquiries of Mayor and City Council. Well, first somebody has some noise going on that's kind of disruptive. If you could mute your microphone. Thank you. I would like to welcome everyone for joining us tonight. I would like to start by clarifying a little bit about my request of the council on discussing COVID. I wanted the council and our citizens to hear where our numbers are currently based on the information and discussion, then determine what action, if any, will need to be taken. There is not any proposal on the table at this time. If we're not discussing a topic just because, if we're not discussing a topic just because it's controversial, then we're not doing our job. We know people are passionately divided on the subject of COVID-19, and there is still a lot of unknowns pertaining to it. When it's time for the discussion, I want to share the number of cases we have had, the recovered numbers, and active cases for Seminole and the county. We will also be joined by Dr. Shane Fisher to provide some additional information. I would like to thank those that have reached out to myself and the council pertaining to COVID-19. We love hearing from you. We'd like to hear from you a little more often on subjects that we have or concerns that you have, but I really do want to thank you for those. With that, moving on, I would like to congratulate the Seminole Chamber of Commerce and all those involved with the fireworks show we had on July 3rd. It was another success. I hear people talking about it, and so congratulations for all the hard work that you put in to achieve that. With that, I would like to move on with remarks from the council. Bill Wantlin from Ward 1.
I do have something I want to say when we get to the public hearing that has been presented to me, so I'll share with you at that time. Otherwise, I would simply want to say that this is a time of deep concern for everyone in this country and across the world. And I have to say to you, it is my own opinion that we're not going to get out of this deep mess for at least another year. Not until we get a vaccine that is acceptable and workable. And that doesn't appear to be possible before next summer. So we're going to have to be dealing with this and the problems for the next year. Pray hard, stay safe.
Thank you, Bill. Ward 1, Larry Church.
Thank you, Mr. Mayor. First, I'd like to thank you for having Zoom meetings because they're safer and it allows for an increased public participation. And I'd like to thank you for your leadership during these difficult times. It's something I know I couldn't do. And I don't think that many people could do it as well as you have. I'd also like to give kudos to Steve Saxon, who with the support of our community leaders has, according to today's paper, has moved us from 57 among the 77 Oklahoma counties to 37 since, I guess, in the last 10 years. And that's according to the United States Prosperity Index. We appreciate that. That is for, it moved us, we've moved from 57 to 37 as a good place to do business. And I'd also like to thank the anti-mask protesters for exercising their right to peaceful assembly to redress their concerns and doing it in a peaceful way. And also, I'd like to thank them for letting us know that there's a large enough contingent among us that will not willingly take the simple steps of wearing a mask and exercising social distancing without some sort of mandate. You know, the CDC and other healthcare groups have recommended wearing masks and social distancing when around those that are not your immediate family. And there's evidence-based research by such places, independent places, Johns Hopkins and wherever else, that demonstrate that it is effective in helping control the spread of COVID-19. Being an old and vulnerable person, I appreciate and thank everyone for wearing their masks in public. Thank you. That's all.
Thank you. Ward 2, Stephanie Lambert.
Okay, well, I'd like to once again thank everybody, but this may be my last council meeting. It looks like we are going to close on July 28th, and and if it goes on further, then I will, resign. But I will turn in my resignation upon closing, because if everything falls through, and you guys might be stuck with me for a while longer. But But right now, we are looking at closing on July 28th. So for now, I am planning on resigning at the end of the month. But so far, I'd also like to, so far it looks like I'm here for a little bit, but I'd like to thank the people that have called or texted or messaged me over the last few weeks or last few days, I'm sorry, about the mask. And it's been about 50-50 on my end. About 50% of the people want masks, and about 50% of the people don't want masks. However, almost everybody that called, they are concerned about the numbers, whether they are for or against, something with mask. But I did, tell them, that, thank you. That their comments are welcome, and we need to hear from them, because we can't do what we need to do and what's best for them if we don't know what they're thinking and what's going on. But anyway, that's all I have today, Jeff. And I'm kind of sad that I don't get to spend more time under you as mayor, because you've been really a great mayor. And I want to thank you guys all. And you guys have all made being a city council person really fun too. And I really love arguing and debating, and with all of you guys, it's been fun. So if this is my last council meeting, thank you guys for making it entertaining as well as respectful. And you guys have been great.
Thank you, Stephanie. And if it is your last meeting, I'm sure we'll see you again. Ward
Maybe.
2, John Kramer.
I have nothing.
Thank you. Ward 3, Corey Crabtree.
First off, thank you, Jeff, for clarifying what this meeting was about with the mask portion. I had a lot of calls on this as well, but I am in the same boat as Stephanie. I text a lot of people, and I think some of them are probably on this meeting too. But we got a very good mix of people who want it versus don't want it. So it's gonna be really interesting. I'm really excited to hear from the public. And two, this is the first fireworks show that I've seen in Seminole in several years. We usually are out of town, but it was great. So kudos to them as well. So that's all I have.
Thank you. Ward 3, Tim Poplin.
Thank you. It's all pretty much been said. When we discussed the COVID mask deal, I have maybe a minute worth of talk. If you don't mind, Mayor, put it off till then. But yeah, I appreciate it. And the fireworks show was great. So kudos to all those people that put that together. So I'll reside my time. Thank you.
Thank you, Tim. Ward 4, Chris Anson.
I've been contacted by several people regarding this mask issue as well. I had a few more today, came in favor of it this afternoon. I guess it's closer to the meeting. They decided to let me know how they felt. Up to that point, it had been mostly people who do not want us to mandate masks. I had, prior to this agenda being issued, I had been contacted regarding food services wearing masks. And while I do feel that those in the food service and perhaps in businesses, that conduct transactions where social distancing cannot be maintained, I think perhaps that those employees should wear masks. I just do not feel that the government has any business telling everyone as a whole that they have to wear masks. I myself, if I'm in a position where I can't social distance, I carry a mask, and if I feel uncomfortable, I will either put the mask on or I will leave. And anyway, I just wanted everybody to know where I stood on it before the public got to, or started adding to it. I just wanted you to know where I stood on it.
Thank you, Chris. Ward 4, Trace Connor.
I have nothing to add other than I wish I'd have been here for the 4th of July fireworks. Sounds like it was a great show. Thanks.
Thank you. All right, we will move on. Consideration and action of consent agenda.
Move its approval. Second.
Roll call, please, Jay.
Chris Hansen,
Sorry about that. I couldn't get the mute to come off. Yes.
Larry Church,
Yes. Something's making noise.
Repeat it, Jay.
Stephanie Lambert,
Yes.
Trace Connor,
Yes.
Tim Poplin,
Yes.
Bill Wantland,
Yes.
Corey Crabtree,
Here.
John Kramer. You there, John?
Yes.
Motion.
Thank you. Without any items removed from the consent agenda, we would normally move on to appearances or petitions from the audience. I'm going to wait and have that include it with our public hearing, if that's okay, Brad, and just have it all in one. Okay, I'm getting a nod from Brad that that is fine. All right, with that, we will move on to elections and appointments. The following mayoral board and commission reappointments for a 3-year term through June 2023 for consideration and approval. Board of Adjustments, Zach Northrup.
Motion to approve.
Second.
Second.
All in favor?
Aye.
Aye.
Yes.
Those opposed? Lake Commission, Micah Baker.
Move to approve.
Move to
Second.
second.
All in favor?
Aye.
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 Those opposed? Park Board, Lauren Schatzel.
Move to approve.
Second.
All those in favor?
Aye.
Aye.
Those opposed? Planning Commission, we have 2. We'll do each one at a time. Mark Shell,
Move to approve.
Second.
Second.
all those in favor?
Aye.
Aye.
Those opposed? Planning Commission, Chuck Shattuck.
Move to
Move to
approve.
approve.
Second.
Second.
All
Aye.
those in favor?
Aye.
Aye.
Those opposed? Seminole Urban Renewal Authority, Richard Parks.
Move to approve.
Second.
All those in favor?
Aye.
Aye.
Those opposed? Thank you very much. Jay, did you get all of that?
I did, sir. Thank you.
Thank you. We will move on to current business. Consideration and possible action to approve the annual memorandum of agreement with Seminole County to provide jail facilities and services for the incarceration of inmates for the period July 1st, 2020 through June 30th, 2021, for the sum of $32.68 per calendar day per inmate for the use of the jail and for supervision of inmates.
Move to approve.
Is this the same rate it was? Anybody know?
Mr. Saxon, we
We have-
didn't hear you.
we have
Are
a
you
question.
muted?
It's about the same.
Hopefully you can hear me. Can everyone?
Yeah.
Okay.
Now we can.
Yes, we're good to go on that contract. It's the same as what we've had before.
Okay. Just curious.
Move
Move to approve.
to approve.
We have a motion.
Second.
Second.
Roll call, please, Jay.
Chris Hansen,
Yes.
Larry Church,
Yes.
Stephanie Lambert,
Yes.
Trace Connor,
Yes.
Tim Poplin,
Yes.
Bill Wantland,
Yes.
Corey Crabtree,
Yes.
John Kramer.
Yes.
Motion passes.
Item 2, consideration and possible action to approve the annual lease agreement with Seminole State College for the Oyler Park baseball field and all equipment for the period July 1st, 2020 through June 30th, 2021, the sum of $1.
Move to approve.
Second.
Roll call, please, Jay.
Chris Hansen,
Yes.
Larry Church,
Yes.
Stephanie Lambert,
Yes.
Grace Connor,
Yes.
Tim Poplin,
Yes.
Bill Wantland,
Yes.
Corey Crabtree,
Yes.
John Kramer.
Yes.
Motion passes.
Item 3, consideration and possible action to approve the annual lease agreement with Seminole Public Schools for softball field number 3 and concession number 2 of the Seminole softball complex for the period July 1st, 2020 through June 30th, 2021.
Vote to approve.
Second.
Roll call, please, Jay.
Chris Hansen,
I'll abstain from that.
Larry Church,
Yes.
Stephanie Lambert,
Yes.
Grace Connor,
Yes.
Tim Poplin,
Yes.
Bill Wantland,
Yes.
Corey Crabtree,
Yes.
John Kramer.
Yes.
Motion passes.
Thank you. I would like to skip number 4 and move to number 5, and then we'll come back to 4. Consideration and possible action regarding participation in the construction of the Seminole State Educational Foundation's baseball facility located near the new Seminole High School. This is the specific request is that the city of Seminole forego an amount equal to $75,000, which is the proceeds from the sale of donated property. Steve, would you please expand on that?
Yes. Me?
Yes.
So just to refresh memory, we had, at least years ago, we had discussed participating in college on the construction of a baseball complex. And at the time, we were talking about building a baseball facility behind Emmanuel Fellowship Church near the Seminole State campus. We talked a lot about doing in-kind service and perhaps buying pipe and improving the road. We went as far as to budget for $300,000 to do the road improvements and the sewer and water, et cetera. So obviously they've moved locations. They've moved over the Highway 9 adjacent to the high school. And they are requesting that we donate or forego collecting $75,000 in a donated amount. So let me get a bit into the donation. Roger and Pam Parks had agreed to donate to the Seminole Educational Foundation a parcel of land in Shakota, Oklahoma, which used to hold their manufacturing facility for Blue Wave boats. The educational agreed to receive money, and the Parkses agreed to donate that with conditions. One of the conditions was that the city was to receive a ratio, a proportion of the proceeds if that property ever sold. So the Educational Foundation did sell the property, and the proceeds that are due to the city are $75,000. And so the Seminole State Educational Foundation made a formal request of the council to forego the $75,000 in favor of building, putting that toward the baseball facilities near the high school.
Will the high school be able to utilize that facility?
Could you repeat that?
Will a high school be allowed to utilize that facility? Practice and games and things like that.
Yes, I'll answer your question as directly as I know the facts to be. the facility will be available from Seminole State's perspective. The discussion that I've heard from the Seminole Public Schools is they likely would not use that.
Is there any particular reason they gave why they wouldn't want to use something next door?
If you'll beg my pardon, I'd rather not. It's on third-hand information, but I
Okay.
the letter from them as to why.
Yeah, that's fine. I just wonder, seems awfully convenient to have a facility like that next door and to not take advantage of it. That's it for me. I mean,
Steve, if the Parks family had intended for this money to go to certain places and one of them was the city, are they okay with us turning this money over to something else?
That's a difficult one. I've not checked with him. Of course, Roger deceased, but the agreement in place with the Seminole State Educational Foundation, it gives them basically the latitude to do whatever they want with that money. So the direct answer to your question is, I don't know. I've not checked. The other side of it is the Seminole Educational Foundation does not need that permission.
Well, as far as us foregoing it though, I mean, I'm fine with it, but I do think that since it was requested to be a certain way, that perhaps we pass this pending that there aren't any objections from the Parks family.
I agree with you.
I would make that a motion.
Sure.
If I leave money to something, of course, everyone knows I won't have any to leave. But if I do, I'd like to see it go for what I intended to go for.
I think, Mayor, may I have permission to speak? This is Tim.
Of course.
Since it's the Parks Money Foundation, I think we need to have their blessings on whatever we do. And that is only my opinion and mine only. But that's where I'm going to throw out there, and then I'll leave it to you guys and girls.
Could we entertain, could I make a motion that we table this until the next council meeting? And in the meantime, I asked Steve or someone to contact the Parks family and see if they'll give their blessings to us doing it.
Of course.
Okay. I'd like to make a motion that we table this until we can hear from the Parks family.
Second.
Roll call, please, Jay.
Chris Anson,
Yes.
Larry Church,
Yes.
Stephanie Lambert,
Yes.
Grace Connor,
Yes.
Tim Popland,
Yes.
Bill Watland,
Yes.
Corey Crabtree,
Yes.
John Kramer. You there, John?
Yes.
Motion to table passes.
Thank you.
Thank you.
With that, we will move on to the public hearing. So I will open a hearing to the public regarding the opinion of requiring face mask in public places as a method for reducing the public health risk associated with the spread of the COVID-19 coronavirus. With that, I'm going to invite Dr. Shane Fisher to come on and just share some of his thoughts pertaining to the virus. And then we will move on to comments from the public. Dr. Fisher, please.
You're on mute. There you go.
We still can't hear you. we will
Must be a
wait for
COVID
Dr.
conspiracy.
We will wait for him to join.
Mayor Griffin, this is the moderator. Just,
Yes,
can you give me just a minute or two? I'll see if I can help him out.
thank you. We will pause here while we're trying to get the technical difficulties resolved.
Hey, I think we're all doing a lot better with this Zoom stuff. At least I'm more comfortable now. And it seems to go more smoothly. So I really like this audience participation opportunity that we have with it.
I would ask that anyone that is on to please mute your microphone. If we have too much noise, we may have to kick you off so we're able to hear. Thank you. Well, I'll tell you what I will do while we're waiting on Dr. Fisher to come on, I will go with my comments and then we can move on to Dr. Fisher when he gets reconnected. So what I wanted to provide are some of the numbers and some additional information because as I've talked to some of our citizens, they don't have a clue as to how many cases we have in the Seminole. They don't take the paper, so that way they are unplugged. So I want to just provide these numbers just for informational purposes. These do come from the Oklahoma State Department of Health. And as of today, in Seminole, the total number of cases we've had are 39. We've had 2 deaths. We've had 18 people recovered, and we have 19 active cases. Seminole County have had a total number of cases, which includes Seminole in the numbers, 78, 3 deaths, 41 people recovered, and a total of 34 active cases in the county. While the percentage of cases in Seminole is a little over half of 1% of the population, the rate increase when looking at the numbers was a surprise to me. Since July 1st, we're up 21 cases, which is about a 64% increase if we just kind of look at the numbers that way. And we all know that numbers lie and liars use numbers, right? That's what we've all heard. So these things can be spun almost any way you want it. But those are the numbers that the State Department provide us or that they provide every day. You know, it's still a small percentage, but the growth is what kind of caught my eye. Yes, we're doing more testing, but besides that, it's just the fact that is this the start of a snowball? We don't know. You know, we continue to see, or will we continue to see numbers like this? Again, we don't know. Did social distancing, masks, and other recommended items which were put in place earlier in the year help to slow it down? Well, everything's up for debate, it seems, and it's kind of split. You know, seems like 50-50. That kind of seems to be the way our country is today. But that's why I felt it was important to at least have a discussion on the subject, because there are those people that don't have access to those numbers, and they need to be aware so they can make wise choices on whether they want to wear masks, whether they want to truly do social distancing, or whatever safety, if you want to call it safety precautions, that they want to take. I think it's important that we're willing to talk about these subjects, even though they may be touchy. Again, that's part of what I think we should do. I know, as you've already spoken about, that our council members have been contacted. I've also been contacted. The numbers vary on 50, 50, 30, 70 on what people would like. And but again, the big part is that we talk about these things and we're not willing to shy away. And what I really am encouraged about, though, is that our council members have been contacted by our citizens. A lot of times we go through different subjects and we do not hear anything. And therefore we go off of what we believe is best. I encourage you to contact your council members if you have questions, concerns, or just want to talk about something that, you have an idea on something. That is why our council is here, to be able to represent you and share your concerns. So with that, it looks like Dr. Fisher is back. So I will turn it over to Dr. Fisher. Nope, looks like we're still having technical difficulties. How about if we go on to some of our citizens that are on, and we'll come back to you a little bit later. All right, with that, I would be open it up to our citizens. So moderator, if you would allow the first one to come on, and we may have several people, so we may have to limit the time that you have to speak, but please share your concerns with the council.
Okay, Mayor Griffin, this is the moderator. I have a couple that have dialed in by phone. Figure we can get to them first. First is going to be phone number 380-6048. Unmuted now.
Okay.
Hello.
I will
this is Will
ask.
Cooner. Can you hear me?
Yeah. Yes, I would ask that all of our guests, if you would again state your name and your address, we would appreciate that.
Hello, my name is Will Cooner. I'm at 1011 Crestwood Court. Thank you for letting me speak. I'm addressing the council to ask that you mandate masks. I believe that this will be the best solution to address this horrible disease. I understand that this is viewed as a political statement, which is abhorrent. Wearing a mask should represent that we as a community care for one another. It has become quite apparent that we as a city are somewhat alone on our battle with COVID-19. We have been doing the same thing for the past few weeks, and as we can all see, infections just keep going up. Everyone wants to cherry pick the data to fit their agenda, but this virus does not care about political agendas. Fortunately, people are healing from the virus, but at the same time, we still don't know enough about the long-term effects this virus has on people. We must take every precaution we can, and we as individuals need to adhere and accept these precautions. We must each be a leader in this fight and show everyone that we are going to beat this together. We mustn't keep kicking this can down the road in hopes for a vaccine to be developed. We have to take every precaution to give the scientists time to develop a vaccine. The wearing of a mask is just like the shopping carts at Walmart. Some people prefer to leave the carts out in the parking lots to wreak havoc on each of our cars. Seeing how the wind is almost always blowing in Oklahoma and there are cart returns on each aisle, this is incredibly selfish and lazy. Well, the masks are no different. It only takes a few people to choose not to endure the minor inconvenience of wearing a mask in our businesses to rapidly increase the spread of this horrible virus. This is why a mandate is required. There have been various studies showing how masks greatly reduce the spread of this virus. As we near the new school year, we hope that our children will be able to get back to in-person learning sooner than later. It's starting to seem clear they will have to wear a mask and socially distance for that to occur. We must all together show them that it's okay. We are all in this together because we care for each other. Thank you for your time.
Thank you, Mr. Cooner.
Jeff, are you able to hear me now?
I can hear you now.
All right. Yes, I greatly appreciate you giving me the time to come and talk to everyone today. Unfortunately, there's a lot of misnomers and misunderstandings about what masks are for and how they work. The first that, there have been no studies or any of that done, which is absolutely not true. I'm actually looking at a study right now just to let people know. The biggest misconception is people don't understand that the mask that you wear is not to protect you from the coronavirus, but actually for other people to be protected from you. Basically, if you wear nothing at all, studies have shown anywhere from 10 to 20 feet, when you cough or sneeze, you can actually expel micro droplets that can transmit a virus that far. We know that just a single bandana typically 85 stitches per square inch. A cough or sneeze will only travel 3 feet 7 inches. If you use a double folded handkerchief as a mask, it can only go 1 feet 3 inches. An actual stitched mask that you've made at home with quilted cotton can only go 2.5 inches. A commercially purchased mask will only go less than 8 inches, and an N95 mask allows it to go less than 1 inch. With social distancing and mask wearing, it absolutely is true that you decrease the spread of a virus. Not even just the CDC, but in history, the last 20 years, we've known with macro droplets and micro droplets that masks and social distancing do help. The problem becomes is when people look at whether or not to wear a mask, it's much more of an inconvenience rather than as far as medical. And so we do know that the masks and distancing do work. The biggest problem is I think it was said earlier by Larry maybe, that we are definitely at least 10 to 20 months away from any possible vaccine. And so the problem becomes is, we've now seen almost double the number of cases over the last 10 days in Seminole County that we had seen previously. So we definitely know there is an uptake. We know at the hospital, we just went back to allowing no visitors due to this uptake or upswing in corona cases. And so the problem becomes that at this point in time, the only way that we actually have to fight it is social distancing and a mask. The main thing that people have to look at when determining whether or not to wear a mask or to have some sort of mandate is whether or not you believe that there truly is a coronavirus, whether or not you believe it's deadly, and whether or not you want to actually help fight it. And so at this point, if there's any specific questions you would like answered, I'll be more than happy to answer those.
Dr. Fisher, I'd like to ask about herd immunity. I've heard that some people think that that's what we're going to have to go through is develop a herd immunity. But I've also heard that people could catch it more than once, that they can recover from it and then catch it again.
There've been a herd immunity obviously refers to the fact that if you have 100 people, 70 of which have had a disease or been exposed to it, there becomes less and less people to help transmit that from one person to another. And so there is some question as to whether or not we should allow it to just propagate, and then that way we can get to herd immunity quicker. The biggest reason that people forget as to why we started the Flatten the Curve campaign to start with is not to decrease people's possible future exposure to the disease, but rather to slow it down to allow medical people to not be overwhelmed. When the Spanish flu hit in 1919 to 1920, that was over an 18-month period that it did devastation. We would be able to handle that medically if it were spread out over 18 months. The problem is we don't want it to spread so quickly.
Dr. Fisher, we have lost your voice.
Okay, and so we don't
you're back.
We don't want to overwhelm the hospitals to the point that we're unable to take care of these people, especially since it is mainly a respiratory disease and you need ventilators, ICUs, and that type of thing. And so, we would like to get to herd immunity. The problem becomes is, like I said, we are a long way away from any sort of immunization. We have had, like I said, we also had our first pediatric death just recently in the state of Oklahoma. And I know that's also got a lot of people's attention.
Dr. Fisher, one of the things that I hear often is the fact that, well, those that have died have all had an underlying condition. But that's not what I've heard. Some reports that healthy people have died from this as well. Can you kind of expand on that, on your knowledge?
With any disease that you have, absolutely it's going to go after the people that have comorbidities or other medical conditions. The problem becomes is obesity is also one of these conditions that can cause a problem is considered a comorbidity with this. And roughly 60% of America have obesity to some degree. So you're already talking about 60% of the people could be affected. But everything from hypertension, diabetes, yes, it does affect those people more. However, there have been multiple cases of people who have gotten it, children who've gotten it that have been healthy with no underlying diseases. There's also been, I know, a few reported cases of physicians that have died in New York that had no underlying diseases whatsoever. And they were in their 40s.
And is it also true that if you contract this virus, that there are clearly different levels of illness that you can receive from it? So if someone's wearing a mask and it does penetrate through in a cough, that you may have lesser symptoms than if maybe they just did it without the mask?
Yes. I mean, if you wear the mask, your exposure will be less. And so if I have less of an inoculum, then the probability of me being able to even catch the disease is less. We do know that each person that gets it is responded differently. You know, we all know people that have gotten, and I hate to compare it to the flu, but we all know people that have gotten the flu in the wintertime that, you know, other than a low-grade fever, they've had no other symptoms. And we know roughly 50 to 60,000 people a year die of the flu. So you are somewhere between, you know, minimal symptoms and death. And so there's a wide range. We also know with the coronavirus that some people have no symptoms whatsoever. The latest report I saw said that 30% of all people with the coronavirus are asymptomatic and 50% have minimum symptoms at worst. And so that tells you that, you know, half the people that get it, you know, may not even realize that they have it. And so that's why, you know, if you just wore the mask when you had symptoms, you've already missed half the cases. And so to answer also Larry's question, there is some concern at this point that there's definite mutations that have been identified with coronavirus. So if you've gotten it once, you do have the possibility of getting it again. And so they're unsure whether or not how easily you'll be able to contract it again.
Thank you. Do we have any other questions for Dr. Fisher?
Mayor, could I ask a quick question of Dr. Fisher?
Please.
Dr. Fisher, is it your opinion that masks would help reduce the viral load? Speak to the viral load issue and let us know what your opinion is.
Well, at this point, I don't think it's my opinion. I think it's been proven fact that we know that in order to contract the coronavirus, it has to do with the amount of exposure, especially over a period of time. And so, you know, the less time that you spend next to each other, in other words, if you are social distance, then you're not near each other. The second thing is to decrease the viral load. And so by wearing the mask, you absolutely decrease that viral load. And by maintaining social distancing, you decrease the time that you are in contact with someone else, both greatly reducing the probability of contracting the virus.
Dr. Fisher, if I may.
Yes, sir.
I've always been taught, or I was taught in school, that the flu is higher during the winter months than it is during the summer months, not because the temperature changes effect on the flu itself, but because people are indoors around each other more during the winter months than they are in the summer months. I think that some people believe that with warm weather, the virus will go away. And I've been taught that it's secondary to warm weather. Do you know anything about that?
Yes, you are partially correct on that. I know in the past that we've contemplated that, lessening the distance between people will like make the virus run. The other thing too is people tend to get, runny noses and spread it through contact that way. The problem becomes that blows that theory away is the fact that we've easily seen the number of cases increase. We know that recently, if I'm not mistaken, the total number of hospitalized patients in the state of Oklahoma has never been as high as it is right now. And so at this point in time, we see the cases going up exponentially again. And so, it was the summertime that we've seen this spread. I hope that's not true, because otherwise it means it spreads even quicker in the winter. And so, but it's been spread. That does not seem to slow it down at all, the temperature.
Thank you.
No worries.
Mr. Mayor, I have a question for Doc.
Please.
Dr. Fisher, thank you for coming on. You really enlightened a lot of areas that I've been asked and questioned about. One thing that has been asked me is, the warm weather is one, but the other, do you think that the rise in the numbers reported is the fact that they're doing a lot more testing now? In the earlier days of when there was no test available, we couldn't get them, that there was a lot of asymptomatic people that had it that just wasn't reported. And now they get a runny nose, that they can be tested. Could that be a reason why the numbers has jumped so much, sir?
I would say yes and no. I mean, there is some truth to that. Obviously, we all felt frustrated when the virus first came about, because we could only, test certain people, and it took a week to 10 days to get the results. So overall, yes, you can say that the increase is the number of tests done. However, that hasn't greatly, increased in the last week, as that we've seen, whether it be the protests, July 4th celebrations, the Memorial Day, those groups, the testing hasn't significantly changed in the last 2 weeks. So we should have seen, increases then as well, but we haven't seen it until now. The other thing is although that would explain some greater positives and why we have more total cases, it would not explain why we have more hospitalizations as well. We've been testing hospitalized patients since March. And so, every patient that we've hospitalized was tested even back in March. And so now I just got a report from our CEO, Clay Franklin, who said that the total number of hospitalized patients with coronavirus is greatest than it's been the entire pandemic. And so that would kind of negate that it's just more people have it that are asymptomatic.
I'd like to add one thing in my personal experience. I attend to about 100 clients in facilities, with medical conditions, mental health conditions. And since the 23rd of March, we've had those facilities on total lockdown, where no one comes in without their temperature checked and wearing a mask. And there are no visitors, and no one goes home to visit and comes back. No one goes to the grocery store, or any of that stuff. All of that is taken care of for them. So from the 23rd of March until today, we've had 0 cases of COVID. And a lot of these people, over 70% of them, I would say, are at high risk to contract the disease because of secondary health conditions or their age.
I would, if you don't mind, just to expand upon that, I told, an observation that we had this past spring is once we started social distancing and once they put some of these mandates in place, we actually saw the flu stop. We were seeing 5, 6, 7 cases of the flu per day. Once the mask, social distancing, and all that started, the number of cases we actually had stopped. And so that's what it does to the flu.
I have a question, Mayor. You don't mind?
Please. Nope.
Okay. Dr. Fisher, one of the complaints that I've heard I've received 50-50 on the calls, 54 and 50 against. But the ones that have been against it have all said that the mask, that they can't breathe in the mask and that they breathe in CO2 and it causes health issues for people with respiratory viruses or respiratory diseases or respiratory issues. Can you enlighten me on that a little bit more?
There's been a couple studies. I know the most commonly one cited was actually a study where they measured without being too technical, they measured the partial pressure of oxygen in people's bloodstreams. They were dealing with surgeons that were wearing masks during surgery. What they found is there was a slight decrease in the oxygen after surgery. But when you carefully read that study, it says that they were not sure if it was other things as well, whether it be the stress of the surgeon doing the surgery, whether it be mild hyperventilation, whether it be, the mask or all of those things. We do know the thicker the mask, the greater the impediment upon breathing. So when we wear an N95 mask, we actually have a nurse that has COPD that's not been able to work and has actually had to take off. But, what I was saying earlier, even just a bandana around the face will decrease your ability to cough or sneeze to less than 4 feet. So it doesn't have to be a surgical mask. It doesn't have to be the N95, any covering. The other thing too is, going back to what they teach in elementary school, cover your mouth when you cough and sneeze, that also decreases it. And so why some people do have COPD and they have difficulty breathing, those people would have to go with a lighter mask that would allow that rather than the big thick mask. Most of the things that I've seen too on people not wanting to wear masks had more to do with whether or not, you had the ability to pass such an ordinance, that they didn't want to be told what to do. And I still have people even to this day question me whether or not the coronavirus is even real. Is it really that deadly? And is it really more than the flu? And so that's the questions that I get as to why they don't feel that they should wear a mask. And some people are just tired of having to go through this. And they think if we just hurry up and get that herd immunity over with, then we're good to go.
Do we have any other questions for Dr. Fisher? It doesn't look like we do. Would you like to have or say any closing comments?
Well, I tell you what, I do not envy you guys right now when it comes to making any sort of decision. It's a no-win situation. You got, people on both sides are going to be upset. I think it all just boils down to is, I tell people I have 5 questions that I ask everybody when they ask me about the mask. Do you believe it's real? Do you believe it can kill people? Do you believe it can kill people under the age of 75? Do you want to fight it? And how bad do you really want to fight the virus? The only fight that we have right now is masks and social distancing. So, but good luck on your choices.
Thank you, Dr. Fisher. You're welcome to stay if you'd like, but we appreciate your time that you've spent with us.
One last question, Mayor. Will we get to have a football season if we wear masks?
I think he already left. All right, with that.
I would like to add
yes,
before we go to the public, if you don't mind. I am not arguing the merits of wearing a mask. I'm not qualified to even argue that. I just have an issue with government telling somebody they have to put something over their face. That should be a personal choice, something that somebody discusses with their doctor. Anyway, or, it certainly shouldn't be at a city level. The second thing I have to add to that is even if we were to pass one, I don't know how we would enforce it. We don't have the police manpower to go around handing out tickets to everybody not wearing a mask in public.
That's agreed.
So, if the state wants to do it on their fine, I will comply with whatever law is issued by the state. If it's passed here, if you guys choose to pass it here, I will comply with it. But mine is from the the conviction that the government shouldn't be telling people to put something over their face, pure and simple.
Okay, I would like to state the fact that there's nothing on the table, no motion made at this time on anything. So that would require a motion for it to be voted on. So I just kind of want to clarify that. If we can go back to our citizens, do we still have someone that's on the phone that has been waiting?
Yes, I have someone that's been waiting.
Well, I'm actually talking to the moderator. If we have someone on the phone.
Yes, sir, we do. We have a caller at 661-209-1443. I'm going to unmute him now. Caller, go ahead.
I might ask if you would please state your name and your address.
Okay. I'll mute him again, and then we can move on to the next one.
Okay.
Come back around to him. The next one, Dana Miller.
Hi, Dana.
That's what I'm talking about. She said she's on the meeting and that she would like to speak and that she has raised her hand.
Yep, she's on the
Hello,
list.
can you hear me?
Yes, we can.
Okay, great. Hi. Hello, everyone. Thank you for
Hello.
having this opportunity for us to join in on the council meeting. I love the Zoom format, and if it stays this way, I think you might get more participation from the citizens. So thank you so much for doing this, and thank you also for, I think someone said, having the hard discussion. I really appreciate that, because these are really trying times right now, and sometimes it's easier to just stay silent and pretend there's not a problem. But I appreciate your leadership in that you are addressing an issue before it gets so out of control that we're devastated as a community. So I want to thank you for that. I know a few of you. I just want to say, oh, I'm sorry, I forgot to say my name, Dana Miller. I live at 507 North University. Lived in Seminole my whole life. I love my town. It's my town. I don't work here. I drive an hour to work every day and an hour back. And people think I'm crazy for doing that, but it's because I love my town and I don't want to leave it. I want to stay here and I want to fight for it. And so that's just a little bit about me. A couple of years ago, we had a tornado hit our town. I believe it was in October 2017, I believe, or 16. And what really solidified for me that Seminole is not only a place where I live, but it's part of me, was the volunteer efforts and the community togetherness that happened right after. I volunteered. I reached out to Steve immediately, like the next morning, I think, and said, what can I do to help? And one of the things that I was asked to do was to coordinate volunteers to help clean up and help, remove debris from people's yards, things like that. So over a course of about a week, I talked to strangers, probably over 100 strangers in town on the phone, people coming to my home, going out to different sites and meeting people. And it was all just this wonderful togetherness. How can we help each other? And Councilperson Anson, I want to say that during that time of all those people I spoke to, not one said to me, the government can't make me help my community. Nobody ever said that. They always said, what can I do to help? That was wonderful. That was an emergency time. We are in an emergency right now. This, if you could look at it in the terms of the tornado, right now the sirens are blowing. We're in an emergency situation. So, I want to say that I believe in, that's the Seminole I believe in. the Seminole that the people came together and said, I will sacrifice and do what it takes to help my neighbor. I know my neighbors helped me. They allowed us to get in their shelter that night. So that's the Seminole I believe in. And I just want to say that right now we're desperate for our leaders to not make political statements right now. We're desperate for our leaders to protect us. And there's remember your servant leadership. You're not serving the people to make political statements. You're serving the people because it's in your heart to serve the people. And right now we're desperate for help. And I have, children, I have an elderly mother. I don't, my Larry Church is my council person. I've already spoken to him, but I don't just live in my ward. I shop in another ward. I go to the doctor in another ward. I go to the park and walk in another ward. So while I've already spoken to Larry, I just want to thank you all for the opportunity to speak to all of you, because Seminole is my town. And I would really appreciate you all passing or putting on the table some type of mask ordinance until this emergency is over, until those sirens are off. So again, thank you for your time, and I appreciate you all.
Thank you.
Thank you very much. And I always love to hear people that live in Seminole, praise Seminole, and want to continue to live here, as I do. I love the town, and thank you very much for your comments.
Thank you.
All right, moderator, if you'd put in the next person.
All right, next one's going to be a Misty Leeson, I believe.
Okay, thank you. If you would please state your name, well, we already know, and your address.
Misty Leeson, I'm trying to get to my video. I'm not used to this.
We're not either. We're not either.
We're working on it.
Yeah. Okay, hold on a second. Sorry. I live at 37 University. I live in Larry Church's ward. I have talked to Larry Church on the mask issue. I do not think that I should be mandatory to wear a mask in public. If people want to wear a mask to Walmart, let them. If people have, underlying conditions, they need to wear the mask in public. But I do not think it's y'all's responsibility to make me wear a mask in public. I mean, yes, healthcare providers wear them, and churches are making people wear them. I mean, I'll do it for my church, but I won't wear them in public. I will not. I just don't feel like it's y'all's responsibility to make us wear them in public. Yeah. I agree with Chris Hansen on the mask. I don't think it's the government's responsibility to tell individuals that, you need to have a mask on. I do social distancing at Walmart when possible. I do wash my hands. I do common sense. Hand sanitizer, wash my hands, social distancing when possible. I do that. But I even have Lysol in my Jeep. So, I mean, yes, this virus kills people. Yes, this virus is real. But I have God on my side. God's protected me this far. He will protect me throughout this whole virus, and I I pray over Seminole. Seminole is my home. And I have friends who said, if this passes, they will not shop in Seminole if y'all mandate this. So, and that's something y'all probably need to think about is people, if y'all mandate this, they'll probably go somewhere else to shop, even if this is our home. And this isn't just affecting the city people. This is also affecting the rural area because they come in and they shop in Seminole too. But that's what I have.
Okay, thank you, Misty. Misty, I didn't get your address because there was some noise when you stated it. Would you mind stating it again?
37 University.
Okay, thank you very much. Thank you for your comments and your time.
You're welcome.
Moderator, if we would move on to the next.
Yes, sir. Next one's going to be Robin Bieber.
Okay. If you would give us your address.
Robin Bieber, and I'm at 400 West Strother. And
thank you.
I agree that I'm not necessarily for a mandate. I'm obviously very concerned that we protect our community. And I have no desire to be a part of infecting my community, but I don't believe that dictating a wearing of any type of covering, especially out in the public, is required or really should be done. Now, obviously, maybe inside of a building, I'd possibly agree to stepping into a building that maybe you would be you're required to do that. But also, I'm against any type of mouth or nose covering. I really wish Dr. Fisher had stayed on because I have a question about like a face shield. Obviously, if the whole idea of is preventing projectiles from going out of your mouth and nose, then what about wearing a face shield, like a clear covering in front? I'd be much more open to that than by any means putting something over my mouth and nose where I'm a firm believer in oxygen flow. I do a lot of breath work. I do Qigong, which is a Chinese medical exercise. And it's actually a breath work and energy work. And I'm a firm believer that restricting my breath would actually cause me harm. And I believe it cause other people harm as well. So I would be more in line to actually have some sort of face shield where it doesn't restrict the oxygen flow, but it actually prevent projectiles from coming from me from a sneeze or a cough. And that's kind of what I have to say. Thank you.
Thank you very much for providing your comments, and we do thank you. All right, moderator.
Mayor Griffin, the next comment is going to be a M. Steger.
Okay.
Hello.
If you would please provide your address.
307 Reed Street.
Thank you.
Eric and Martha Steger.
Okay, please proceed.
My comment is that someone said that it was up to debate as to how serious this is or how we go about attacking it. And I think if you believe in science, that issue has been settled, that we know that the only way right now to deal with it is by using the mask and the social distancing. And by requiring the mask, we don't have any issues with having to wear shoes or shirts in restaurants. So why should we not be able to request that people wear a mask for the time being? I just think that we have got to take care of each other and to care about each other and to protect each other. And the way we can do that as a community is by honoring each other by wearing a mask and taking care taking care of us that way. I have a question for the city councils. Some of you that are opposed to it, if you're not going to authorize a mandate or request that people wear masks, how do you suppose we're going to deal with this? How are we going to solve the problem?
I would like to state that this is strictly for comments and not for questions directly related to the council at this point.
Okay, I'm sorry, I didn't realize
that. That's okay.
I still would
That's
like
fine.
to know. Do you have anything to say?
That's fine.
Okay.
And as we go into the consideration possible action section, they will have their opportunity to speak toward that if they'd like.
Okay, all right. Thank you for your time.
Thank you.
Thank you very much. All right, Mr. Moderator.
Yes, sir. Hang on one sec for me.
Sure.
I know we have a couple others that have joined, but they don't have their raised hand emoji up. I want to try the phone call one more time.
Okay.
This is for 209-1443. Caller, if you can hear me, go ahead.
Hi, my name is Anita Chase. I'm at 1015 McKinley. And I basically have no questions other than to say that I was really pleased with Dr. Fisher's explanation, and I am for the mask. I appreciate all of you and love the town that I live in. And I will shop here whether we have mask or no mask. It's a difference of pickup for me or going into the store. If masks are required, I would be so happy about that. And my husband agrees with me. Thank you once again, and that is all.
Thank you for
very
calling
much.
in.
Thank you.
All right, Mr. Moderator, if we move on.
Yes, sir. We have a B Tiger that is entered the meeting. I'm not sure if they have a question or not. They haven't raised their hand.
Okay, we will give them just a few minutes.
Second.
If anybody else has a question, go ahead and use the raised hand emoji. Okay. B Tiger has a question.
All right. Please proceed. And please state your name and your address.
Yes, hello. Can you hear me?
Yes.
All right. My name is Billy Tiger. I live at 507 North University. I just want to say that I am for the mandate of wearing a mask. I've worked in the public for many years, and I work for the public right now where I, help customers, on a daily basis. And I just, at my work, they mandate us to wear a mask, but, in order to keep this virus from, spreading and, harming other people who are trying to keep their family safe, like what I'm trying to do, keep my family safe. I don't go out and do a whole lot. I mean, I stay home and, be around my family and just, care for them. Cause like I said, I hate for them to, get sick or myself to get sick. And, with me, I've had a issue where I hit close to home. I had an aunt pass away from COVID-19 back in April.
Bless your heart.
So it's just, I mean, that right there is just, that's too close to home for me, to, not to wear a mask. Cause like I said, I mean, I understand, people want to, socialize, see their friends, family, whatever, but, sometimes you gotta take what's best interest to, be safe and be cautious, because in the long run, you want to see them for the rest of your life and rest of their lives. So so I just want to say I'm for the mandate of wearing a mask in public. To me, I think it's a very, valid, precaution that we have to take. We want, we want this, to end soon, but it's not going to end anytime soon. I've talked to my primary care provider earlier today. We were talking about it, and he's just telling me stuff about that he knows on his end of, because like I say, he's in the medical field, and we just had a little discussion about it earlier. But I just feel it's something that we should all take pride in. I mean, like I said, and I agree with the Ms. Seeger. I will shop here in Seminole with or without a mask mandate in stores, as this is my hometown. I've loved this town. My kids grew up here. I have a lot of family that live here. I love this town. All right, thank you.
Thank you very much. Okay, Mr. Moderator.
Yes, sir. Doesn't appear that anybody else has a question at this time. We did unfortunately have a person drop out that had to leave early. He did have a question and left us a email. Dr. George Monks. Would you like us to read this, or do you have access to it? Or
I don't believe I have. I do have access. I will read his comments.
Okay.
Thank you. From George Monks. He stated, I'm logging off, but as president of the Oklahoma State Medical Association and over 4,000 members, we strongly encourage you to pass a face mask mandate. I hope you can read the letter that we submitted online as our testimony. It was submitted through your online portal. I don't believe I have that, or I've seen it. Maybe we can have that provided to us. It may have to be later and after the meeting. But that was his comments before he had to leave.
Yes, sir. I actually have that in front of me now.
Mayor, would you like that read, or would you like it provided at a later time?
Is it, I would ask the question, is it very lengthy, or is it, you'll be able to read it in a minute or so?
It's probably a little bit longer than a minute or two.
Okay. Why don't you provide that to us after the meeting?
Yes, sir.
All right, thank you. All right, with no other citizens that would like to comment, I will close the open meeting.
Mr. Mayor?
Yes, sir.
One of the people from my ward was unable to be here tonight, but he did drop off a couple of documents he wanted me to present.
Okay.
The New England Journal of Medicine May Perspective Report and the April Center for Infectious Disease Research and Policy Report. And I'll be glad to furnish these to you. Basically, what they say is they're primarily concerned with the necessity of wearing masks in hospitals for the medical staff, but saying that it isn't that effective in the general public. That's what he wanted to present that and could not be here. So we asked that I would do that. So I will present that for him. And that's Brian. Sure.
Thank you.
Mayor
Then before I
Griffin,
close, I would, yes, sir.
This moderator, we do have one more question.
Okay.
Which appears to be the last one.
All right. Thank you.
Jake, go ahead.
Oh, hi. It's not more of a question, just more of a comment about
Okay.
being in favor.
Would you
of
please
the
state your
mandate.
name? Yes, would you
Jake
please state your
Tiger.
name and your address? Okay.
Jake Tiger. I live on University Street.
Okay, please proceed.
Like I said, it's not more of a question, it's more of a comment about being
Okay.
in favor of the mandate of the mask. One, like we're seeing is the numbers rising here in Oklahoma, and I understand a lot of people want to get out. I do too, but it's a sacrifice we're going to make. This is a kind of a hopefully once in a lifetime kind of thing, and there's a lot of risk right now. This virus doesn't care if you believe it or not. It's still going to come, and it's not more of I'm scared for myself. I'm scared for everybody else. I don't want to be responsible for getting somebody else sick and being careless. So I think the mask can help reduce the numbers, because now we're starting to look in the long run, about another year or two until they find a vaccine. We know the trials are going on, but like I said, it's gonna be a while till they find something. And that's about it.
Thank you for your
Thank you.
comments and for joining us tonight. Mr. Moderator, do we have any others?
No, sir. No further.
All right, thank you. Do any of the council members have anything they'd like to offer that's maybe from their constituents?
Mr. Mayor, this is Tim.
Yes.
I'm going to keep it short. We all have opinions about this, and people have documentation to back it up. And I believe that we as council members, a lot of times the decisions are pretty easy to make, because to make the city infrastructure and all of that, it's got to be done, and it's a real easy yes. But something like this that affects the public and a lot of people out there, they have great ideas. Everybody has an opinion. We all have an opinion as council members. I have my opinion. You guys have y'all's. And so I tried as a council member not to voice my opinion, because this is a situation that we represent the people in our district or ward, okay? So what I did is I went out, and I'm not going to get in the weeds here, promise me, and I'll keep it short. But I went out and talked to a lot of people, because my job as a council person is to represent the people, not voice my opinion on a situation that really affects everyone. So in my survey, it started out, it was like a 50-50. And the age groups that I talked to was 77 to 17. And overall, and I'm going to, like you said, just kind of round this off, it was probably a 65-35 vote that it was no. And I listened to their comments and the reasoning and all that, and everybody really had a real good reason. Just like all the great people that called in and talked tonight, they've all got reasons, and every one of them is a good reason. Dr. Fisher enlightened us. He enlightened me on a lot of things that I hadn't heard yet. We can see things on the news and draw opinions, but my position is to represent the people in Ward 3. And like I said, it was like 65-70% no. So I have to represent my people in my ward, even though if I don't even feel like it's right. But that's kind of where I'm at on the deal. And that's kind of where I'm going to leave it. And I just kind of said that for the record. And I think, that's what we're here for, is to represent the people. And I really appreciate the people that took time to call in and voice their opinions. And we live in a democracy, and democracy means exactly what it is, the voice of the people. So thank you guys for just listening to me. And I'm sorry I stretched it out here.
Thank you. If we do not have anything else from our citizens that you would like to offer, then I will close the public hearing. I would like to thank all those that called in. We want to hear from our citizens. And, when it's an easy choice, as Tim mentioned, it's okay, but these are hard decisions that are we may or may not have to make. But we want to hear from you, and thank you for taking your time to voice your opinion. With that, I would move back to current business, item 4, consideration and possible action regarding safety protocol and precautions surrounding the COVID-19 pandemic, including but not limited to requiring face mask protection within the city limits if citizens are in a public place. Again, this is a discussion, and I believe that there would have to be a motion made in order for us to be able to, yes?
Mayor, real quick, and I hope Brad is still with us. I think we have so many of the dark video that we need a quick roll call to make sure we still have quorum ever so often. So
okay,
I think we're probably
that's fine.
Need to probably roll call again to make sure they're with us.
All right, Jay, would you please provide roll call?
I will. Chris Anson,
Here.
Larry Church,
Here.
Stephanie Lambert,
Here.
Trace Connor,
Here.
Tim Poplin,
Here.
Bill Watland,
Here.
Corey Crabtree,
Here.
John Kramer,
Here.
and Jeff Griffin.
Here.
So we still have a
Thank
quorum.
you. Thank you. So we have item 4 on the table. And again, if you have some additional discussion, now would be the time to have it.
I have a question. Well, unless someone can go before me, but what would be the enforcement of this, even if it were passed? Here's the thing. I am 100% for people wearing face masks in public, especially in crowded places where you can't social distance. Even for ourselves, we just got back from Branson. They were doing a pretty decent job of it up there. But our problem is we have nothing written and nothing in place that allows us to enforce this. Nothing. Even if we passed it, what are we going to tell our officers? What do? Do they write a ticket? Do you just tell them to put the mask on? How many times can you tell them? Who's keeping a record of who you told, who you haven't told? Who's going to rebel? Who's not going to rebel? I don't know how you could even enforce this, to be honest. And I'm just being honest. I 100% agree with it, with wearing them. I think they're helpful. I just don't know that we could really enforce something like that. It's going to be really, really tough. You guys on the council know, Sharon Emmett can tell you how hard it is to enforce the tall weeds and grass ordinance that we have. And my only comment is you will quadruple, if not way overextend ourselves trying to keep up with what's going on. I mean, if we choose to give them a ticket, your courts are going to fill up with all these fines, but how much are they going to cost them? What are we going to do when that comes about? That's my only issue. I mean, my thing was to be either enforce this in the businesses, tell these businesses to get a little more strict on how many they're letting in the door. If they can't keep control of who they're letting in the door, if Walmart's not going to keep track of how many people are actually walking in that store, then someone needs to take some action and do something about it. But I gave this example to somebody else. A store that's small, like Factory Connection, where you may have 4 or 5 people there at a time, much less exposure than if you walked into Walmart and there are 10 people there standing right over the ground meat trying to buy meat for a cookout. I mean, there's a big difference. But my problem with this is not that it's not something we need at all. It's just how would we enforce it? And I don't think that we could even come close to passing something if we don't have something written that says this is how we're going to go about this. These are your penalties, and this is what happens if you choose not to do it. That's my
Good
thought.
point. Good point.
Mr. Mayor,
Yes, sir.
I do want to raise an issue that it doesn't directly involve this, and yet it does. The recent U.S. Supreme Court Mcgirt decision. city of Seminole does not have criminal jurisdiction over defendants who are Indian anymore. So it goes to tribal or federal court. You need to be aware of that. This is going to create a real problem, not just on this issue, but on everything, including running stop signs.
What about tall weeds and grass?
Yes, same thing there too.
Yes. Well, I have some thoughts on this, of course. It's true that we can't enforce it with our police.
Opinions.
And we can't, I mean, it's just something that we can't handle. So the enforcement, if there's any enforcement in it, is going to fall to the retailers, who they permit into their building and who they don't. And it's an undue, I mean, it's a burden for them. I don't like for government to tell me what to do any more than anyone else does.
Opinion.
And I do want to represent the constituents in my ward, but I think that I've been elected to this office to make decisions that aren't popular. I don't think that I should take a vote of the people in my ward and then vote accordingly, because I think they've elected me because I feel like that I'll make a good decision. And so when it's time to make a motion, I have a motion. So let me know, Mr. Mayor.
Bye. Do we have any other comments?
Mr. Mayor, this is Tim again. I'm sorry, Brad, go ahead.
No, that's fine. I just wanted to maybe point out something to the council. I do agree with Corey. You know, we don't have a proposed ordinance in front of the council. I have reviewed the Norman ordinance. It's quite extensive. It defines face coverings. It talks about public settings, public accommodation, where it's mandated. There's many exceptions to it. You know, there's so many different ways if you're thinking about doing this, there's so many different ways to draft an ordinance. I was looking at the proposed Tulsa ordinance. I think they're going to debate that tomorrow night. In that particular ordinance, you talked about enforcement this is just for your information, you know, for their proposed penalty is, you know, a first time offense would just be a warning. The second time offense, they would receive a misdemeanor and it would be subject to no less than a fine of $100. You look at Norman's ordinance, for example, I think their ordinance is $50 to $500, I believe. I mean, it's kind of apples and oranges on that end. But again, you know, I think the input from the public here has been great. I honestly can't remember a time where we've had such great input and comments. And Dr. Fisher's information has enlightened me just for my own personal office here and the people that I'm around daily. But I really think if you're going to consider this, we probably need to really staff this and get some feedback from you, Mayor, and the council on how we would even tackle it. And I do agree it's going to be a very tough one to enforce. Let's hope that Ms. Miller's comments about everybody, you know, wanting to do the right thing and protecting their neighbors and their relatives and everybody are going to do the right thing, and in the spirit of just caring for one another. But you know, we can't always depend on that. I understand, and there's going to be people that don't want to do it. So enforcement is a big key, and drafting this ordinance is going to be key as well. So I just wanted to bring that to everybody's attention.
Yeah, I would agree with that. The thing is, I don't think anybody can truly vote on an ordinance that you can't see what all's written in it. I mean, because we're going to be flying by the seat of our pants on how to run this. I mean, when is it going to force? Well, we don't know any of that. You know, it's just like the dog ordinance we've been discussing and, you know, things of that nature. I mean, we've discussed those many times. That's my only issue. I don't know that you guys can, I mean, I guess you can. And I think it's an emergency deal, but I think if we're going to treat it as an emergency deal, then we need to make a motion that someone come up with a committee that will look at those two ordinances that maybe are being looked at or have been passed to see what all is involved with them before you just pass something. I mean, we don't know what we're passing besides the fact that someone has to cover their face. But obviously to those two ordinances have a lot more in them than just that from what you just spoke of. So I don't know.
Well, I don't think we have a lot of time to mull it around because since the 1st of July we had 41 cases now in Seminole County. Now we have 78. So if we do throw it to committee or review of some sort, I would like for there to be a short time limit, like 1 week or 2 weeks, where we could come back and revisit, have a special council meeting or whatever to vote on it, because the longer we wait, you know, at some point the question's moot.
Yeah, and I'm not going to argue that point with you at all, Larry. I think you're right. I'm not saying you're wrong, but obviously,
well, I'm not trying to.
I think
you've got good points and very valid, and we need to know what we're voting on, and we don't. But our attorney has offered a model that we might be able to look at and
correct.
see if we can adjust it to fit our situation. And I just think the fact that if the council came forward, I don't know if the mayor can make a proclamation, you know, do something in the interim, whether, you know, like he has in the past, but that might be appropriate until we can, I mean, he might just make a recommendation that people do.
I think in the meantime, I would be okay with us strongly enforcing businesses to take a look at their models on what they're doing and be sure that they're appropriately doing what they can for the time being. Okay. But in the meantime, that will give us a chance to look at those two models to see what we can model after, what we can do. Because if we don't, we're going to end up with egg on our face and we're going to end up on the news again because we don't even know what we're enforcing.
And if we're going to dump it onto the retailers, which surely we're going to have to dump a large portion of the enforcement onto them, I think we should subsidize their expenses for masks and things like that, that they will have to pass out at the door to people who forget them, don't have them, or whatever, you know. So there's a lot involved in it. We ask a lot of our retailers who are suffering greatly through all of this. And we can't enforce it with police, but we can ask them to turn people away.
I'm not asking them to turn them away. I'm just asking them to come up with some better solutions that would help. That's all I'm saying. I'm not asking for them to. Yeah. I mean, we have a business. You have a business. We don't want people to stop coming, but you know, you got to find a way to help. But I just don't think passing something that's not even written or we know what we're doing is smart. I mean, I'm all for people wearing it. I
don't think it's smart either for us to go off half-cocked. I do think that the difficulty with problems like this, especially in health situations that I have a lot of experience with, the difficulty is pulling the trigger. You have to pull the trigger in a timely fashion in order to get positive results. So I think that we need to review this, but we need to do it in a short period of time. We haven't seen the figures come back from the 4th of July holiday yet. What we're seeing is activity before that has bumped the numbers of positive cases up. But we've got, what is today? Today's the 14th. So we're 10 days into it. We've got another 4 or 5 days before we'll start seeing what the results of everyone having a good time over the 4th of July, which I really am glad that they did. But I think we'd review it.
Yeah, again, I just want to reiterate, just so no one takes my words wrong, I'm not against it at all. I just want to know what exactly we're enforcing, if that were the case.
I'm certainly not thinking you're against it. I think you have valid points and stuff that we need to consider and do before we pass an ordinance. But when, like I say, I think that we need to get moving on it. We can't just kick it down the road until, we can't even kick it down the road until the next scheduled meeting. That's what I'm saying. I think we should act within 2 weeks maximum.
Mayor, may I speak? This is Stephanie.
Of course.
Well, I'm sorry I turned off my video because I'm doing things around the house as well. But
You're in
I
tune.
really just wanted to point out a few things that Mayor Fisher and that I've heard over the last few weeks. I don't know if you guys know, but I had to be tested for COVID on Thursday because one of my neighbors who is asymptomatic and I visit with every day tested positive. He said 30% of our positive tests are asymptomatic, which means there are people without symptoms at all walking around out there thinking that they're perfectly all right, most likely without a mask, coughing and talking. And I don't know how many people I've walked up to at Walmart that are close talkers and they just come right up to me and start to visit with me, just right at my shoulder or right at my face. And I wish that I had something that says, hey, listen, other than my mask, because usually I'm wearing a mask, that said, please, I'm observing social distance, but they don't pay attention to that. I'm willing to donate my time, or to, take a couple of days to help with this if I need to, because this is like the last portion of my haul here, as a representative. But it is something that I'm really passionate about. That's about the welfare of our people. And one of the comments that was made to me was by one of our residents, and she said, she texted me and she said, the thing is that we don't know that she's like, most of the people don't know that we need protection. And that's a very true comment. And when we have to protect, when we're speaking on behalf of our ward, my ward is mostly elderly people. And we have an elderly center right here in Ward 2. And one of the things that I really think of is that these guys, they go to the grocery store too. Most of them she said that she goes to the curbside pickup most of the time because she's afraid to go, because the last time she went to Cash Saver, she said people weren't wearing masks and people were coming up really close to her. And so I'm with Larry Church about, we have to do something soon. And it's the next meeting will be too late. We need to get something, because by the time we get to the next meeting, the numbers will have increased. That's it for now.
Thank you. Any other comments? Okay, if anyone is going to make any motions, now would be the time.
I would like to move that the city of Seminole review the mandates that are enforced in Norman, Oklahoma, and the mayor to appoint a committee from among us to look at that and come back within 2 weeks with a recommendation for what we'll do about mandating masks and social distancing in public places in Seminole, Oklahoma.
I'll second that.
Roll call, please, Jay.
Chris Anson,
No.
Larry Church,
Yes.
Stephanie Lambert,
Yes.
Trace Connor,
No.
Tim Poplin,
Yes.
Bill Watland,
Yes.
Corey Crabtree,
Since I started it, yes.
John Kramer,
No.
motion passes 5-3.
Thank you. One of the things I would like to say is while we are going to be reviewing some of the other requirements in some of the other cities, that during that time, we all have a choice as individuals. The purpose, one of the purposes of having this discussion was that we can make an informed choice. You know, we've heard what our citizens have said. We've heard what a doctor that's in the field has said, because we know that a lot of times we listen to those that we like to listen to, and their view is similar to ours. I believe it's important that we hear from those opposing views, but in the end, it's all an individual's decision that we have to make, whether it's to wear a mask or not to wear a mask. And while we are going to be reviewing this, I would encourage everyone to make that choice based on information that you receive that you can trust. I would like to make one other statement on this, and then we'll move on to reports. You know, as Dr. Fisher mentioned, the whole purpose behind masks, social distancing, and all of those that were in place earlier in the year was to slow the spread of COVID. It wasn't to get rid of it. We know we're not going to be able to get rid of it, but it was to slow the progression so that we don't have full hospital beds where those that are ill cannot get a treatment, which probably means they're going to pass. And so that is really what's behind the mask and everything else. So again, please make a wise choice based on information. All right, with that, we will move on to reports. Our city manager, Steve. Is Steve still here?
Steve is muted.
Oh, okay.
Very good.
So Stephanie just informed us that one of my neighbors has COVID, so I'm going to be on high alert there. We're going to miss you, Stephanie. We appreciate your service for everything that you've done, and good luck to you in the near future. And I know that you've agreed to serve on another board, and that's very gracious of you. Thank you for doing that. You know, this time is really stressful for everyone. I just want to give a pat on the back to my city employees who come in day after day and do the things that have to be done to continue to operate a city. And I'm really proud of the way that they've conquered a lot of the stress and fear surrounding the COVID incidents. And I'm just really proud of what they've done. Is anybody curious about the roundabout? I'm not, I guess. I'm curious about the roundabout. So the latest is that are waiting on the rock to be installed in the middle of the roundabout. The striping is due within the next 10 days. The striping company had been delayed, and there was a question as to whether the concrete was ready to receive the stripe. So within the next days, you're going to see the whole thing take form, and we should certainly be driving on the roundabout within this month. Now, we have ordered with OG&E, great to work with. We've got 4 lamps that are not permanent. Nothing in the middle of the roundabout is going to be permanent. So it's going to be put in there. It's not meant to be real decorative. We want it to be ugly, but it's not meant to be a final solution. I think the mayor will eventually have a committee that is going to look at what do we want to have happen in the middle of the roundabout. So we're looking forward to that. I want to give a shout out to all the citizens that agreed to come. I know public speaking is a big phobia for people, and so that's a big deal. To have that level of participation, fantastic, great job. You know, Butland alluded to the court decision, the Supreme Court decision, and I don't want to step on Brad if he's got any comments, but the things to come are uncertain. I think there are probably a long list of compacts that may be coming down the road. And we don't know what that looks like. There'll probably be a lot of lawsuits and court decisions to follow. But as of right now, we are going on as if nothing is different. And so we're going to continue to operate business and do with you know, we're going to acknowledge that the court decision happened, and we're going to work well with the light horsemen and do the things that we need to do to be responsible. But in just about every other matter, we're going to continue to do business as normal. And that's all I have, Mayor.
Thank you. City Attorney Brad Carter.
Mr. Mayor, I know Bill Wantlin brought this up, and Steve just touched on it, but Mcgirt versus Oklahoma. So again, a landmark decision by the Supreme Court that could potentially touch more than we care to even want to think about in eastern Oklahoma. I will tell you that the Attorney General has issued some guidance for all law enforcement. And as Steve said, right now it's going to be business as usual. There's going to be a few little things that we're going to have to work through. This primarily, even though this was a decision that affected the Muskogee Creek Nation, it does affect and will affect all of the 5 civilized tribes territories, but it especially the Seminole Nation. One of the things that we have in place right now, and I think I know John Chief Withers is with us. We do have a cross-deputization agreement in place. That was something that was recommended by the AG's office. We're going to review that with them, and we'll probably be reaching out to make sure that we're all kind of on the same sheet of music going forward until we get more clarification. Bill Wantlin is correct. There's going to be some major changes the way we look at certain crimes. I can tell you that any of these major crimes, I don't really envy the district attorney's office here as well. They're going to have charging decisions that are going to be very impactful, or in their case, non-charging decisions that will have to be transferred or referred to the federal authorities and the Bureau to prosecute those things. How that affects us, really, there's so many things. I'm not even going to begin to go into them, but there's guidance, that there's checklists, there's things that we're going to have to resolve together with the tribe. And I think that we probably are going to need to be looking at beginning that process sometime soon. Fortunately, I understand that the Creek Nation has already began that process. Am I right, Steve? I think that's from what I understand, they've reached out and they're already working that issue. And I'm hopeful that once that's done, we'll be able to work out the compacts that we need. But it is something we're following very closely, and we need to be following very closely. And again, even though this talks about criminal activity and jurisdiction, I think it's going to reach out into other things and other areas that in the future that we're going to have to deal with. And with regard to the COVID discussion that we had today, I stand ready to work with Steve and move forward as fast as we can. We've got a good template for an ordinance. It won't take very long if that's what the committee recommends. I think that, we do need to get some guidance from Dr. Fisher. There was a question about face shields. I didn't even think about that. It's a good point. We've got to think about things like that. And, but I'll be ready to follow Steve's direction and make that happen as soon as possible. That's all I have, Mr. Mayor.
Thank you. I have 2 additional comments. Now, I saw a picture of someone with an air filter on their head for a car is that something we need to check into for all those hot rodders? They can come out with something. One of the comments we had from one of our citizens was they liked the Zoom meeting. I would like to remind everybody that we are only allowed to host or to have our Zoom meeting with our council meeting while we are under an emergency order by the governor. That was something that he had just updated again on July 10th. And so I too, while there are increased cases, I like doing it via Zoom, but there will be a time that we probably will have to stop this and meet in person. And but I just wanted to comment on that, the fact that it's not necessarily our choice to continue this forever. It's while that's in place, we're allowed to hold our meeting via Zoom. All right, with that, we will be moving into executive session. We'll have consideration and possible action to enter into executive session under Oklahoma Statute 25, Section 307.b.1, discussing the employment, hiring, appointment, promotion, demotion, disciplining, or resignation of any individual, salaried public officer or employee, fire chief. I would entertain a motion to enter into executive session.
So moved.
Second.
All those in favor?
Aye.
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 Those opposed? All right, we are in executive session. We will log out of this meeting and we will be logging into a separate Zoom meeting. Again, I want to thank everybody for your comments. We do appreciate that. Thank you.